These are some really amazing statistics. In just the last 4 years, more than 20 pharmacies shut their doors right here in Indianapolis. And that left the residents that live in those areas living in what is called a pharmacy desert.
Yeah, tonight our Emily Longnecker talked with the staff at a West Side Community Center about the impact they're feeling.
This building behind me used to be a CVS on Lafayette Road. Not anymore. It sits empty, and it's not the only one.
16 CVS Indianapolis locations have closed over the past 4 years. The 5 Walgreens locations have also shut down too, the latest just last month. A Walgreens company spokesperson said when deciding whether to close a store, the company looks at several factors, including the local market and the buying habits of patients and customers.
I know people that they take Lyft rides to get there to pick up their to get their prescriptions.
Here at the Hawthorne Community Center on the near west side, staff says several clients have been impacted by pharmacy closures.
A lot of people don't have transportation, fortunately.
That led to one client, says Jama Bennett, not getting a prescription.
She couldn't get access to her meds, so she had mental health issues.
Even when people have access to public transportation, barriers still exist.
And especially when the weather's colder, it's hard to, you don't want to walk out with your baby in a stroller to get on a bus but I know people that do, because that's their only option.
Dr. Andrew Schmeltz, an assistant professor of pharmacy practice at Butler University, said the closures could be the result of a number of factors, including increasingly razor-thin profit margins in areas where household incomes are lower, and a lack of pharmacists after the pandemic, with people leaving the profession and fewer entering it.
We wanted to know what the Indiana Pharmacy Association thought was behind the closures. We reached out to them. We didn't hear back. On the west side, Emily Longnecker, 13 News.
Indianapolis isn't the only place seeing closures of pharmacies. In fact, the entire industry right now is struggling.
And that's having a major impact. For example, in 2021, CVS announced it was going to close 900 stores in years to come. Competitor Walgreens responding, also saying it planned to close 450 stores across the country.
Rite Aid had additional pressure from a massive opioid settlement, forcing it into bankruptcy. That resulted in 250 stores closing. So that's a total of 1,600 pharmacies closing from those 3 companies alone.
And communities of color often are the hardest hit. An NIH study found that 670 neighbors with no pharmacies, 96% were in those communities of color.